Dr. Kaushik has already told you, this particular IC is based on the guidelines for managing cluster endophthalmitis, and these did come out these are very recent, just came out last quarter of 2023, and I'll be just covering some of the definitions and identification of a cluster endophthalmitis. And of course, this doesn't just cover the clinical aspects, but also other aspects like how to communicate with patients, reputation management, because some of these, like, of course, we diligently go ahead with treating our patients, but then there are times when we face such crisis and we really don't know what to do. It shouldn't happen to anybody, but in case it does, so these guidelines will be of help to one and all. So in the present day era, I would say cluster endophthalmitis outbreaks are quite rare because of advances in technology, and we follow certain protocols. Surgery is much safer, but in case it happens, it can have devastating consequences. So we know that cataract surgery is one of the most common surgical intervention worldwide, and incidence of endophthalmitis in the developed world, as reported, is between 0.08 to around 0.1% after cataract surgery as per the SCRS guidelines. And if we talk about India, so there is limited, there are reports available in published literature, and so mind you, this is published literature when we are talking about. The range is between 0.04 to 0.2%. It's in India. So when we come across a case of endophthalmitis, it might be just a sporadic case, but we have to kind of get into the details, dive deeper to find out whether that particular case is part of a cluster, or is it actually just a sporadic or isolated case. So it's seen that isolated cases are usually because of patient-related factors, and it is because of the commensals usually. So staph and strep species have commonly been found to cause isolated cases of endoph. And then talking about cluster endophthalmitis, usually it is, you do find a common source of contamination, and the common organisms responsible for these are gram-negative bacteria, Pseudomonas being one of the main culprits there, and fungi. So what really are the potential sources of contamination? So it's been seen and published that it might come from the surgical instruments. Here we are now talking about cluster endophthalmitis. So, and most of the reports have kind of come out with the contaminated ophthalmic solutions as being the culprit. So it's the balance salt solution, ringalactate, trypan blue, viscoelastics, whatever you are using. And then, of course, in our setting, like in a country like India, I would say a low resource setting, we do commonly use the phaco probe and the tubing also. So phaco probe is kind of used between cases, several cases rather, sometimes through the day. And then the tubings are also used, again, they are reusable sometimes. And then, of course, the intraocular lenses and the solutions, they are also sometimes reported to be responsible for a cluster and intracameral injections. Having said that, I think we should not forget that, of course, we can kind of, say that, okay, the industry, or it was because of the commercial products that we landed up in such a situation. But just the same, it is pertinent that we follow standards of practice in the OT. Standard sterilization protocols are followed for sterilizing the OT, and even by staff. So that, of course, that discussion is for some other day, because there are several best practices which we need to follow to ensure that we don't end up in such a crisis. In fact, I have, I think I should share this. In one of the live workshops, there was a surgeon who was operating, very fast surgeon, and then when somebody asked him that, he or she was not really sterilizing the instruments in between cases. And when he or she was asked regarding why he is following that practice, so it was like the answer was, I'm saying in Hindi because impact better होगा, मैं इतनी जल्दी सर्जरी करता हूँ कि बैक्टीरिया को टाइम ही नहीं मिलता अंदर आने का. So there we are. That is our country for you. And in case, so I hope everybody understood that bit. Coming to the definition of cluster endophthalmitis, well, if you search literature, you will come across several reports and various definitions which are being followed for defining cluster endophthalmitis. But we are happy that AIOS did come up with certain guidelines which were based on ESCRS and the Royal College of Ophthalmology guidance also. So they are all now, and we are now supposed to follow this particular standard, because you don't find this in books, a certain standard specific definition of cluster endophthalmitis. So it is recommended that we follow this particular definition, which I would say is occurrence of 2 or more infections in a single day from one theater, or if you come across repeated post-operative infections under similar circumstances spread over a period of time. So if you come across a case of endophthalmitis, you need to really dig deeper and find out and follow your surgical cases also very strictly. Be vigilant about it as to, to find out if there are other cases happening. So in case you come across a repeated post-operative infection and happening by the same surgeon, the same staff, consumable batch numbers are very important to be monitored, and the same operating room. So you might be, dealing with a cluster there. I would also like to touch upon, normally when we talk about cluster endophthalmitis, we are thinking about camp situations and cataract surgeries done there. But then this is a recent kind of, there's another epidemic happening now of post-injection cluster endophthalmitis. This, of course, the incidence reported is between 0.028 to 0.056%, and more so in the Indian setup, because we are using injection bevacizumab we know that it comes in vials, and we prepare aliquots to kind of just because of just to save costs, we are dividing the preparation there into and using it for several patients. So that is where the contamination happens, and during the compounding process, you can kind of contaminate the aliquots which are prepared, and the infection can happen and can reach the patient. And here is just a report which is from PGI. They did have several cases of endophthalmitis there. So once you've confirmed that you are dealing with, that you have, or you are actually kind of, looking at the, you land up in a situation where you have endophthalmitis and you are suspecting that it might be part of a cluster. So then you follow this much talked about traffic light system, wherein if it's a green alert, you perform a review, check and ensure that the standard theater protocols are being followed, preventive measures are in place, and this heightened vigilance should be in a place if it's a green alert. And if it's an amber alert, then of course it calls for urgent review, a complete microbiological workup, stop regular surgeries, only emergency surgery should be done, and if possible, don't start even regular surgeries till you've identified the cause. And red alert, of course, is like, that sometimes some organization might land up with, say, tens and hundreds of cases following high volume camp surgery. So then, of course, this straight away you are following the red alert there. And it would call for a detailed investigation and closure of operating rooms to investigate the cause of an outbreak. And then the steps, of course, to be followed are that you form an expert team, stop surgeries, review protocols, and of course the patients have to be, don't forget your patients, and usually doctors would be kind of, just focusing on the patients, but just the same, effective communication with the patients and the relatives is equally important. and you have to dive deeper and try to investigate the cause of the source of the infection, and not to forget reputation management and medico-legal considerations are equally important. So while I would say everybody, all doctors, we know by nature, we are kind of, we just go for the patients first and we try to save the eyes. But just the same, you never know what the lawmakers, how the public would react, what the lawmakers would come up with. So essentially, not just, I would say, save eyes, but yes, do save yourself as well. And I would leave the rest to my eminent colleagues, and they would be kind of, covering each aspect as we go along the next 60, 70 minutes. Thank you.